What if I told you if you watch this video, you might save hundreds or even thousands of dollars per year on your prescription medications? I know that drug costs are a huge part of the budget for many people as they get older, especially if they have multiple medical problems and take the proverbial sack of meds. Unfortunately, often their doctors and the FDA don't appear to be interested in helping you make healthcare affordable. That's why I made this video. Let's start with those that have health insurance. If you have health insurance, get a copy of your insurance's drug formulary. That's one way to save money. They will have a list of approved drugs ranked by tier, and the lower the tier, the lower the copay. Sometimes the e-prescribing software that integrates with your doctor's EMR will provide assistance, but do your research and ask your doctor. Next, consider coverage options. If you work for a company that provides health insurance, oftentimes there are different options to choose from. Some may have lower copays on the office visit. Some may have better coverage for prescription meds. If you're one of those that takes a lot of medications, take that into consideration. Next, copays. You might be surprised to learn that sometimes the copay that you're asked to pay from your insurance company is higher than the actual prescription drug cost. Up until a few years ago in my state, it was actually against the law for the pharmacy to tell you that it would be cheaper to pay cash or use one of the discount cards. That changed in my state, but if the drug costs seem too high, ask the pharmacy. Next, comparing prices at different pharmacies is another way to save money. GoodRx or one of the other online services allows you to put in the name, strength, and quantity of the medication you're having and get the idea of the price that you should have to pay at various pharmacies. You can also call your pharmacy beforehand and ask what the price would be if you didn't use insurance. In other words, the cash price. That way you'll be able to find the best deal. Here's the difficulty. Most doctors were coerced into going to e-prescribing about 15 years ago under the guise of improving health care. While it may make it easier for the pharmacist to fill a prescription and not have to decipher a scribbled prescription, it has made it harder on the patient to price shop because he may not know or see the prescription until he shows up at the pharmacy. Your doctor may say that he can't or won't send a paper prescription, and in some cases that may be true. Usually, though, most electronic records software can print out a paper copy of your prescription. Also, it's a hassle to send individual prescriptions to multiple pharmacies, and I suspect many doctors will refuse to do that. So, good luck, but try to get a paper copy if you need to shop around on the cost. Next, request a 90-day prescription. Now, some insurance companies require people on maintenance meds to get 90-day prescriptions for their medicines because it's less expensive. And it is almost always cheaper than getting a 30-day prescription for your maintenance drug. So ask your doctor if you can get 3-month prescription. There may be some limitations on certain types of medications, particularly scheduled drugs or opiates. They are often limited to 1-month prescriptions. Next, I think most pharmacies honor some type of prescription card. They're usually free and found at the pharmacy counter, and enrolling with them will give some type of discount for cash pay patients. Several could be Quick Save, Optum Perks, Single Care, and then there's the GoodRx card that a lot of my patients use. Next, another way to save money is by using an online pharmacy like Amazon. I'm sure there's others, but this is the one I'm most familiar with. Just like other pharmacies, the doctor will have to send the prescription to them, but you will find that on some things they're lower than the price you can get locally. On other things, they may be higher. Do your research. Some people look for prescriptions from pharmacies outside the U.S., maybe Canada, Mexico, India, or Australia. Now, the FDA frowns on this and tries to keep you from doing that, but it occurs to me that many of our medications are made in China or India or possibly even Canada, and Mexico. It also occurs to me that 75% of the funding from the FDA's drug division comes from the fees paid by Big Pharma. So maybe they don't want you to approve them because they're not getting paid to approve them. Just a thought. Next, generic drugs. I always start with generic drugs when I can. Many drugs that have gone generic cost pennies on the dollar compared to their brand name equivalent. And usually they're just as good. The problem comes with medications that are not generic and are brand name only. And that's usually medications that are new or medications that you see advertised on TV or in magazines. Be aware that some doctors have very good reasons to prescribe these drugs, and other times there's financial reasons or other reasons that they're being prescribed. And that occurs even if there's not much of a difference between the old treatment and the new treatment. And when it comes to new medications or drugs, you need to understand what scientists, researchers, pharmaceutical companies mean by the word significant and what everybody else means by it. When most people say significant, they mean substantial or a lot. But in research studies, particularly pharmaceutical drug studies, the term statistical significance is used. The effectiveness of a drug may be statistically significant when compared to an older treatment, but in practical matters, it may not be much different at all. Let me explain how it works. When a company seeks approval for a medication, they need to provide studies that show a statistically significant difference in the previous or the older treatment. The study always starts with the premise that there's no difference in outcome between the control group and the study group. That's what we call a null hypothesis. If the treatment is effective, then to say that the medication works, then there has to be greater than 95% chance that that outcome did not happen just based on random chance. You see the term P is less than 0.05. That means the probability is less than 5% that this result was just a random chance. The two things that will get you to a statistically significant result is one, the effectiveness of a medication, or number two, the size of the study. So if a drug is truly a breakthrough drug and is so far superior to the older treatment or the placebo group, you'll see a statistically significant difference even in a small study group. On the other hand, if the study groups are very large, then a very small or insignificant difference can be considered statistically significant. And once they have that report, they're one step away from getting approval for a potentially very profitable medication. And again, over the past few decades, since the FDA has been mostly funded by money from Big Pharma, there seems to be few drugs that are not green-lit. So then that takes me back to a question that you could or should ask your doctor is, how much of a difference does this new medication that potentially costs 10 or 100 times more than the older generic alternative, how much more effective is it? He may not know. He may be just prescribing it because he was encouraged by the pharmaceutical rep or for some other reason. He may get angry when you ask, so just be ready. Also, if I see a med that is advertised heavily on TV or on the radio or in magazines, my first thought is, well, if this medication was that great a medication and it was life-changing or so good, then why are they having to spend tens of millions of dollars in advertising? I wonder if maybe the reason they're doing it is because it isn't that great, but it is going to make them a lot of money. I don't know. Just a thought on that. Next, shopping at chain store pharmacies. Now, I like to support local and family mom and pop type businesses, especially the pharmacists I know that are in that situation. They do provide a great service and often have a variety of things that big box stores don't have. But if you're looking for the lowest price on prescription meds, you may not get it there. Consider if that's an option you want to look into. Next, ask for samples. When new drugs are introduced, oftentimes pharmaceutical reps will provide the doctor with lots of samples to try to get him using the medicine and comfortable with it. We're not seeing as much of that anymore, but if that's something that's available, ask your doctor. He'll probably give them to you. Along with that, oftentimes there's coupons that will reduce your copay if you have insurance to a much lower rate, even if it's not normally something that would be covered by insurance. You might check into that. Oftentimes the doctors will have samples of drugs and the coupons to get. So it's not something that's going to last forever. And the aim is with the pharmaceutical companies is to get you using the very high dollar medication so that when the coupon expires, then you'll be paying the high dollar for those meds. Next, patient assistance programs. Now, for those people who just don't have any money, they don't have any insurance, and their income is below a certain level, most pharmaceutical companies do have patient assistance programs for their brand name drugs, even some drugs that have been out for a long, not all drugs are covered that way, but that's some research you can do. And I have some patients who get their medications free in the mail directly from the company. I just have to send them a prescription in periodically to prove that they're still getting the medication. The patient usually has to provide information like income verification and the like. Last, and this one might seem counterintuitive, but is the medication necessary? First, certain medical conditions require medications. If you show up to a hospital or a doctor's office with a child with type 1 diabetes, he has to have insulin or he's going to die. If you have underactive thyroid, the only answer there is but many medical problems, especially when they're first beginning, are due to our lifestyle, our diet, our habits. Could be smoking, could be alcohol, it could be obesity, it could be too many carbs in your diet. And by exercising, weight loss, quitting smoking, cutting back on alcohol, many times the need for medication for mildly elevated blood pressure, mildly elevated blood sugar can be reversed without medication. So don't assume that you automatically will need to be put on medication. Talk to your doctor about what are the options. Are there non-medical options? If you have arthritis, maybe you don't need an arthritis pill. Maybe exercise or physical therapy would be an option. Also, if you've been on a particular medication for a long time, particularly if you have made lifestyle changes that would tend to improve your medical problem that you have, ask your doctor whether decreasing the dose or possibly discontinuing the medication might be appropriate. Sometimes patients have been on antidepressants or nerve medications for a period of time and they don't seem like they're working, and discontinuing them is a good option. Again, discuss that with your doctor. Never decrease or stop your medications on your own. Oh, and one last thing. I find sometimes that people are self-medicating themselves with over-the-counter allergy medicines, arthritis medicines, stomach pills, acid blockers, and the over-the-counter meds, which used to be prescription, can be quite expensive, even with the store brand. I have found cases where I could prescribe the same medication, give a quantity of 90 for 3 months supply, and save them significant amount, often half the price of what they were paying for over the counter. So if it's something you're taking on a daily basis, maybe ask your doctor if there is a prescription alternative that would save you some money. So there you have it. If you're having trouble with high drug costs, at least some of these should be helpful to you. Hopefully your doctor and his staff are open to working with you and helping you get effective and affordable health care. Well, that's all for now. Take care and God bless.